you are in a different country. So we have few fellows, Akash, Sudhir, everybody should come. We'll have Mr. Daniel Porter and Mr. Kalpeshchar on the dais for a while. I'll call him. So we need to be very frank. What are the problems? 10 minutes discussion. How can we go? Because all of us has the thought that yes, we should go to UK or USA or Germany, or for that matter, Japan, Korea, anywhere. But it's really tough. We don't know the system. So since we have Professor Daniel Edward Porter, sir, who is a very senior consultant, and he would be just speaking 10 minutes. What are the options? So may I invite Professor, may I request Alok to escort Dr. Daniel Edward Porter, sir. And Sudhir, you may start by asking your question. Yes, sir. And Purushottam? Yes, sir. Mic, can a mic be arranged there? You can sit down there, Alok. So, Professor Porter, sir, actually, problem, like we are in a different country. Our MBCHB is roughly 5 years, in fact 4.5 years. And then we have two options, 3-4 options, either to stay in India or to go to UK or go to USA, and for that matter go to China or Southeast Asia. But if you want to go to UK, do you advise to come before starting the ST programs, or should we do our masters here, which is of 3 years?
I think those options are real options. Obviously you would want to take a job in a unit which is advertising. And that means you can get your GMC license, and you can work and get a salary. And the group coming before specialty training, many hospitals in the UK classify this group as CDF, Clinical Development Fellow. Clinical Development Fellow. And this group perhaps are not certain what they want to do yet. They're thinking about working towards their MRCS, but they haven't got there yet, perhaps. Then there's the later group of specialty fellows, and that group would be for the more senior trainees who've completed some of their specialty work in India. These are the options, I think. I'm not sure if you're thinking, Ashish, about what we would call our senior fellows. These are end of training fellows who
Yes.
are looking to become consultants.
Yes.
This group have perhaps already got FRCS Orth. Do you think there's a large group of Indian orthopedic surgeons who are looking to come to the UK at that stage? Or generally, is it before that?
I have 5 fellows here who had done their 5 years training, getting trained under us, doing FNB, Masters Super Specialty in India. Yes. And half of them are thinking of getting MRCS out of the way. So Akash, you have any questions? So Akash, Himanshu, you can stand up and talk. Ek mic dijiye udhar. So what's your question, Akash? Like, he's been very keen, he wants to go to UK. You can start speaking, it's a small auditorium.
Good afternoon, sir. So can you guide us what exactly we should have in our CB if you want to get into UK, sir?
So Akash, I heard you give a very nice presentation today about robotics, about ankylosing spondylitis and so forth. So tell me what you have done so far.
Sir, like according to Ashish sir guidance, sir,
Tell me what when did you graduate with your MBBS?
So MBBS I finished approximately 9 years ago, sir.
And what have you done year by year since then?
Sir, after MBBS, I went into D-Ortho, so that's 2-year course in orthopedics. So I finished between 2016 to 18. After that, 2 years course I done in DNB, sir. That's equal to MS, post-graduation, sir. So totally post-graduation I finished for 4 years in orthopedics. So after that, I worked with my uncle, sir, Dr. B. Shivshankar from Solapur for 1.5 to 2 years. After that, I took a break for 1 year for preparation of the super specialty. So last year in 2023, June, I got into Anup, sir. So since then, I've been trained by Ashish sir in both hip and knee, sir, and Dr. Sushil Singh sir, upper limb, sir. So next, I would like to go to UK, as sir told, to basically learn the work ethic and improve ourselves. So sir had told us to do publications. Right now in SICOT, I have sent one publication, sir, and I'm second author in 2 to 3 publications in British Bone and Joint Open, sir. So next, what else I should have to be able to go there, sir?
And what about other postgraduate qualifications, diplomas, certificates?
Yes, sir. Diploma, DNB, and one more degree called MNAMS. So 3 postgraduate certificate I have, sir, and
Thank
this
you.
will be 4th one, sir.
And what is your career aim?
Sir, I want to, basically I'm interested in hip, knee and ankle, so lower limb. So my aim is to learn the techniques first in a proper way, then I can decide which area I'm interested more. Like sir is very good in hip, who has taught us hip and knee both. And I met Kalpesh and I got to know ankle, I don't know much. So I don't know where I like until I get exposed to a good teaching institute and high volume.
So you want to come back to India after you finished your fellowship and become continue your senior specialty training back in India after going abroad?
That is the idea currently, sir. It might change, sir, if something.
So do you think that your pathway and your current position is quite a common situation for young orthopedic surgeons in India?
Yes.
Yes, sir. Sir, actually, before coming to Anup, sir, the main lack we had was proper guidance. Since Ashish sir teaches us every day, so the training what we got was from UK and like 9 years he spent. So his 9 years helped us in refining ourselves. We got to know what mistakes we do. So Ashish sir always tells us that when you get international exposure, you'll understand what mistakes you're doing. Until then, you'll not realize where you're at fault.
And what do you want to achieve by a fellowship? What's your aim from the fellowship?
Sir, I'm primarily interested in hip revisions and primary both, sir. So I want to refine my skills so that I'll be able to better practice when I come back to India, rather than jumping early with a raw skill.
So that's clinical experience to improve your logbook, to gain international experience that you wouldn't have here, that would be different here. Would you be looking to try to get another certificate or diploma, an international level, MRCS, FRCS or similar?
Yes, sir.
And which one, MRCS?
Right now I've been told MRCS will be helpful, sir.
How? Why helpful? Helpful in what way?
Sir, I'll explain you. I mean, MRCS to gain a GMC registration, either MRCS or PLAB.
That's right. So MRCS is very helpful if you want to get, it's helpful if you want to get onto a program, just because it's competitive. But can you do MRCS here before you go to the UK? Is that
Yes.
an idea? Is that a plan?
Yes, he can
Yes,
do.
I mean, IMRCS can be sat, it's first a MCQ and then the OSCE. So the MCQ is straightforward, as long as you can do all that bookwork, trying to remember general surgery again and that kind of thing, and applied basic science, physiology of the nerve, physiology of the gut. It's hard work.
Yes.
But that's an MCQ. I think that can be done online these days. But the OSCE, Bombay?
Bombay, yes.
You have to go to Bombay for that. So have you any plans for that?
Yes, sir. As soon as I'll be finishing my another 9 months here, sir. That is my next plan, sir.
What do you think, Ashish? Will you let him do it?
Personally, if you are reading more of surgery, then you get off track from orthopedics.
Right.
That's what I feel.
Okay, so that's what you're going to do in the evening, the weekends, when you're not working with Mr. Singh and his team. You'll be at the books, trying to prepare for your MRCS Part A, and then Part B. Now, Part B itself is tricky. If you've not been to the UK or to or worked in a system similar to the UK. I mean, India has some similarities. Passing Part B is tricky because when you go to, certainly when you go to Edinburgh to do it, they imagine you're in an NHS hospital. And if you've never been in an NHS hospital, it's difficult to get your mind into that situation.
You get lost.
It's not your fault. It's just that you've been used to Indian clinics and Indian operating rooms, and it's a bit different. Perhaps in the examiners expecting you to understand a different concept of, say, the surgical checklist, the safety surgical checklist. They'll expect you to think about it in a different way than maybe Mr. Singh thinks about it, or maybe some other surgeons and hospitals think about it or do it. It's not right or wrong, it's just different, and it's understanding the difference. So that to pass MRCS Part B, it could be helpful to visit the UK for a time. And some of these junior doctors I mentioned, clinical development fellows, are preparing for MRCS Part B because they found it difficult to pass. They want to do that, and then they can perhaps look at another fellowship to get further. If you had MRCS, then that will enable you to get priority onto some of these fellowship programs, get a better quality of, perhaps a better quality of hospital or training unit than you would otherwise have. And I think that's key, to be able to work with a very good trainer and a good hospital where you can feel you're actually achieving what you want to achieve. There's no point you just being in the ward the whole time, clerking patients, putting data into the computer, and not being allowed into the operating room or doing operations or just holding a retractor in an area that you've already done 10,000 and you're not interested, or it's just not your area. So to choose, if possible, the right fellowship is key, and the right hospital.
Yes.
So, if possible, I think to pass MRCS before you come to the UK is ideal if you want to get the better quality fellowship. But I know it's not easy.
Yeah. Any insight from you, sir? How do we get into UK? You are from India, you understand things. I mean, we don't get registration easily.
So, I think for what I have observed over the years, well, first of all, you probably know that we run a fellowship program at the Golden Jubilee.
Yes, sir.
Where we select 2 fellows every year, one for arthroplasty and one for foot and ankle. It is very competitive, and I know the route that people have to take to get to there, but if I could make a broader point for somebody who wants to have a foreign fellowship for all the reasons Akash has mentioned, there is a lot of commitment required for the person to demonstrate, and it comes from clear vision, having a lot of clarity. What Dr. Porter was, I could see that he was trying to probe, almost like an interview he was having with you. And what comes across as from listening to that interview, Akash, is, if you don't mind me saying, not very clear. You want to go, but you are not very clear why you want to go. So, and that is normal at this age, at a young age like you. It is very normal, but it helps if you have a lot of clarity as why you want to go there, how long you want to go there, and what you want to achieve. That is very important. And also, at the end of all that, what are you going to do with all that? What my observation is, because I employ 2 fellows every year, people want to come outside and then a lot of them don't want to go back. And what happens is they get lost in the system. Everything gets diluted, because if you were to come back, you would have a lot of advantages, new ideas, like what Ashish has shown in his hospital. But if you stay there, then you will be one amongst many. So then your career ladder gets halted. It's diluted, so you become one of many. Unfortunately, that happens with a lot of people. So with most fellowships in the UK, the emphasis is that the candidate is given the fellowship for maximum 2 years, so that the candidate can then come back and spread the knowledge in the home country, wherever that is. And I am a strong believer of that. And with every fellow that we appoint, we try to do that. We're not always successful, because I can't stop you if you want to go back to Spain after coming to UK. So, but with regards to our fellowship, the requirement, if I can just make it more practical for you, the minimum requirement is a valid English language test. That's for the visa. MRCS is useful. It's not essential, but it helps you getting the GMC registration. If you have these two, then the Royal College in certain hospitals will be prepared to be your sponsor, provided the institute where you are going to work likes your CV. So you would apply for the fellowship. You would have a valid language test. Now there are 2 options, IELTS and OET.
Yes.
Between the two, OET is easier. So if you get that, it is valid for 2 years. So you have to apply and do that within 2 years. By the time you come to an interview, it can take almost a year. So your language test has to be done well in advance. You don't want to be if you are shortlisted, but your language test is now no more longer valid. That happens as well. So timing is very important. And timing again comes from clarity. And MRCS, which is a useless exam for somebody like you, but it helps you to get there. Now also consider the cost. It's expensive. With the MTI scheme that we employ, there is this thing called EPIC verifications. They have to, there's a body that takes, I think 60,000 rupees or something to verify your certificates and all. Then you have to go in person to verify your documents at the GMC. So that's, and your time away from your family. So it's a lot of commitment, which again will come with clarity. So a lot of money involved, a lot of effort involved, and only somebody who is really sincere and knows why would do it. That is why if I ask any of you, I can bet you that you would not have done MRCS, because you don't need it. So only the one who is preparing for it will do it.
Sir, I'm sorry I'm interrupting at the moment, but what we need to do is that you take some appointment with Mr. Kalpesh and Daniel Potter, sir, and sit down and talk one-to-one. What do you think? Because sir is a very senior fellow, a consultant. Myself, I am there always, and Kalpesh is in the system. So you should reconsider all your thoughts, because after you land up there, you can't take support from your family. Number one, you're lost in another country. मैं हिंदी में बोलता हूँ. I'll tell you in Hindi. Like few years when I started in Dundee, even in a shopping mall, Tesco, the way they spoke in Scottish language, we were lost. Once my wife and myself was in a shop, we asked something, whatever the lady told, we saw each other's face. I mean, what is she speaking? Anyways, okay, it's fine. So in the same way, the system is different, NHS. Like when I joined Sterling for the first time, the nurses used to call sisters or nurses. The SEW scores is 5. You have to come and see the patient. So I used to ask, what the hell is this SEW scores? So this is a scoring system. Anyways, same time they used to talk English, which is very flowery, and you don't get it on phone. So I always used to say, I'll better come and see the patient, because if anything goes wrong, then it's a problem. So we'll have some time after Dr. Kalpesh's ankle session and sit down with my fellows at least, and those who want to discuss with him, frankly, because Dr. Kalpesh is in charge of fellowships at the Golden Jubilee National Hospital. And Daniel Porter sir is well read and around the world. He was in China as well. He might guide you. He might guide you as well. You can go to China. So, yeah. So we'll end this session. Sorry, but we'll have it a brief discussion. You should take the initiative.
Yes.
No more.
Yes, sir.
So thank you, sir, for your valuable time. Now
Thank you.
I would like Dr. Kalpesh sir to take over with the ankle playback video. So,
Thank you,
dear
sir.
team, I am very thankful for staying here. Sir, yesterday we did a live ankle replacement and we are producing it re-live now. So, it's a great honor for all of us that ankle replacement has been done in, at least in Bihar, I think, first time. If you've done, Dr. K. S. Anand, sir? So, all yours, sir. Purushottam, video chal jayega?